Hello, everyone. I'm Eric from here at Strong Medicine. For those of you who are new to the channel, I've been a practicing physician for over 20 years, and I'm a medical school professor. This video is going to kick off a new series focusing on the Trump administration's Make America Healthy Again initiative. Each video in the series will focus on one individual, or in two cases, we'll focus on an entity composed of multiple people who are central figures of Make America Healthy Again. Each video will start with that person or entity's official responsibilities, a brief biography of who is holding the position now, a rundown of what they've done so far, and then my prediction of what impact it likely to have on the health and well-being of Americans moving forward. To see what to expect, here's an organizational chart of the key people we're talking about. There won't be any video on Donald Trump himself because he does not play a significant role in the day-to-day decisions that are defining this movement, aside from appointing people he doesn't properly vet and signing bills into law that he doesn't read. But directly underneath the president is the Secretary of Health and Human Services, former lawyer and infamous anti-vaxxer RFK Jr. HHS has tens of thousands of employees that RFK Jr. is ultimately responsible for, but for this series, I'll be focusing on people in 7 specific positions. The director of the National Institutes of Health, health economist, COVID contrarian, and at least on paper, a Stanford colleague of mine, Jay Bhattacharya. The administrator of the Center for Medicare and Medicaid Services, former surgeon, Columbia professor, and snake oil salesman, Mehmet Oz. The commissioner of the Food and Drug Administration, surgeon and Johns Hopkins professor, Marty Makary. Makary oversees his real-life friend, hematologist-oncologist, UCSF professor, and iconoclast extraordinaire, Vinay Prasad, as the FDA's chief medical and science officer, and the director of the Center for Biologics Evaluation and Research. That second role might sound esoteric, but I assure you it is not. RFK Jr. directly oversees 2 other positions, which currently are vacant, while nominees are awaiting confirmation, which seems likely in both cases. There is Susan Monterez, an infectious disease scientist and former deputy director of the CDC, who's been nominated to be the top CDC director. In the meantime, it seems like there hasn't even been an acting director of the CDC for several months, which seems problematic. And there's medical influencer and one-time Stanford medical student, Casey Means, as Surgeon General. When Monterez is confirmed, she will oversee the Advisory Committee on Immunization Practices. Statements from the ACIP are the federal government's official recommendations on vaccines. While the ACIP does not approve or reject vaccines per se, a role reserved for Makary and Prasad, they do have a huge influence on who actually receives the vaccines after approval. Across 11 previous administrations, the ACIP has been composed of nonpartisan, respected physicians and scientists until RFK Jr. abruptly fired them all last month and replaced them with a group of anti-vaxxers and peddlers of misinformation, most of whom are without relevant experience or expertise. It's not clear to the public who is actually overseeing this group at the present time while Monterez is in limbo, and the CDC lacks an acting director. Nor is it clear whether Monterez will have the authority to replace them after she's been confirmed. But even if she will technically have that authority, I suspect that she won't have the political capital to do so. So far, everything on this chart is within the Department of Health and Human Services and ultimately overseen by RFK Jr. However, there are other cabinet-level offices that directly impact the health and well-being of Americans. For example, the Secretary of the VA, military chaplain, and congressman from Georgia, Doug Collins, is responsible for administering health care to approximately 9 million former U.S. soldiers and other beneficiaries through the Veterans Health Administration. The administrator of the Environmental Protection Agency is military officer, lawyer, and congressman from New York, Lee Zeldin. The Secretary of Agriculture is the attorney and conservative think tank leader, Brooke Rollins. And last, existing outside the executive branch, at least it would during normal times, is the U.S. Congress, the group of 535 elected representatives of the people who are responsible for passing laws, confirming presidential nominees, and determining the federal budget of our country, including how money is spent on healthcare. There was a time that DOGE, the so-called Department of Government Efficiency, would also have made this list, led by the world's richest person and oldest teenage edgelord, Elon Musk. However, it seems like Musk and his minions, after parachuting in from nowhere and breaking a ton of stuff they lacked the ability to understand, have progressively faded from relevance. That's not to say that they aren't still around, but that much of the dramatic and unnecessary damage they've caused is already done and won't be fixed anytime soon. So those are the 12 key people and entities that this series will be covering in the upcoming weeks and months. I will not be doing all 12 in an uninterrupted sequence. This means it will take a while to get through everyone, and because these positions are constantly in flux, that organizational chart will be out of date in some way by the time I finish. The first update will most likely be the successful confirmation of Drs. Monterez and Means. Now, in the unlikely event it was not yet clear, I am not a fan of this group as a whole. While a couple of individuals may be fine, the majority are not. Some of them have no relevant experience in the kind of role they now occupy. Some hold opinions on medicine and science that are far outside that of actual experts. And some have outspoken and polarizing personalities that are already driving away career officials and experienced scientists within the institutions that they're overseeing. Now, I can imagine a viewer watching these videos and saying, "Hey, Eric, you're biased against this person or against this viewpoint." But look, I'm a physician and an educator. I'm not here as a neutral reporter focusing only on objective facts. I'm giving you my opinion as someone whose last 25 years have been dedicated to improving the health and well-being of people in my community, in my country, and I hope to some tiny extent through this YouTube channel to the people of the world. I see the Make America Healthy Healthy Again initiative as an existential threat to what we do and to who we are as medical professionals. I'm also a parent, a husband, a son, and a brother, and I see Make America Healthy Again as an existential threat to my family and myself as a potential patient. This is not an indictment of every single person involved, but as a whole, we are being put at risk. Make America Healthy Again is increasing risk from infectious diseases, stifling biomedical innovation in some places, while in others, recklessly rushing ahead without proper safety considerations. It's marginalizing already vulnerable populations. It's discouraging or even actively preventing some young persons from entering medical and scientific fields. It's working to loosen regulations around the protection of our environment, the pharmaceutical industry, and our food supply. It's spreading medical misinformation to the public, and overall, it's making it more difficult for all of us to access quality health care. People are already dying because of Make America Healthy Again. This is not hypothetical. It is real. There is no room for neutrality on this. Now, some of my American viewers may be thinking, but my health care does not feel any different compared to 6 months ago. And those viewers are largely right. Aside from the measles outbreak, the start of which predated this administration, I agree that it does not feel that different. And that's the problem. When 100 people die in a flash flood, that makes the national news. It trends on social media. People talk about it. An individual person not directly affected by a flash flood in Texas, they may not be particularly interested in the story, but they're aware it's happened, and they're aware of how tragic the loss of life was. However, in 2027, when 17 million people begin to lose their medical insurance, so the high blood pressure and diabetes goes undiagnosed, and 10% of those 17 million people eventually have preventable heart attacks, strokes, or kidney failure years later, the impact, while far, far greater in magnitude, is diffused over such a long period of time that a direct correlation between cause and effect is not noticeable without a dive into statistics. Another example, when a person dies from an exacerbation of emphysema that was triggered by air pollution that the EPA stopped regulating, is their family going to make that connection? A decade from now, when a person's spouse or child dies from cancer, they will never know that their loved one could have been saved by a new treatment if it weren't for some 22-year-old tech bro wannabe at DOGE capriciously canceling an NIH research grant because he saw it involved transgenic mice and somehow assumed it was some DEI initiative. There may be millions of people who are now going to eventually die preventable deaths because of changes that have already happened. And every day that our government and our leaders don't reverse course, that number increases. As mentioned, I've spent 25 years working to become the physician and medical educator that I am today. And the volume of good that I've tried to accomplish in that time, if one could quantify the net improvement in overall human health as a consequence of one lowly physician's life's work, all of that can be counterbalanced in a single afternoon by a nameless political appointee on a whim canceling a research grant that they don't understand. And that's why I'm compelled to talk about healthcare policy and politics. I honestly don't enjoy these topics. I really don't. But if medical professionals ignore what's happening, and if we remain publicly apolitical because of a well-intentioned but misplaced sense that trust in our profession requires our political neutrality, if remaining neutral in all this is what we're going to do, we should just walk away from medicine entirely. Because all the good we are trying to accomplish is a drop in the bucket compared to the harm that our leaders are inflicting upon us and upon our patients and upon our community. So this series, it's going to be full of uncomfortable truths. And if hearing uncomfortable truths filtered through the experience of a medical professional who deeply cares about this country's health, if that's not your thing, or of course, if you aren't watching this from the United States, don't click on the videos. They will all be clearly labeled with an obvious title and thumbnail. Instead, wait for my traditional med-ed content that will still be in the mix. But for everyone else who does want to know more about the people who will be influencing the health of this country over the next several years, I hope you'll watch, and I hope you share with your friends and family, and maybe even with your local elected representative.